Verapamil, also known as Calan Sr., is a medication used to treat high blood pressure. By relaxing blood vessels, it helps to prevent strokes, heart attacks, and kidney problems. Verapamil belongs to a class of drugs called calcium channel blockers, and it also has the potential to lower your heart rate. The recommended daily dosage of Calan Sr. can vary depending on the individual and their specific condition. It is important to take this medication exactly as prescribed by your doctor. Typically, it is best to take Calan Sr. at the same time each day, and it can be taken with or without food. Be sure to follow your doctor's instructions and do not stop taking Calan Sr. without consulting your doctor first. When taking Calan Sr., it's important to follow your doctor's instructions. Usually, it's taken once daily in the morning or every 12 hours with food. Make sure not to crush or chew the extended-release tablets, as this can increase the risk of side effects. The dosage will be based on your medical condition and response to treatment. Take it regularly at the same time each day to get the most benefit from it, even if you feel well. It may take about a week to see the full benefit for treating high blood pressure. And remember, do not stop taking this medication without consulting your doctor, as some conditions may become worse if the drug is suddenly stopped. If your condition does not improve or worsens, be sure to inform your doctor. If you experience dizziness, slow heartbeat, constipation, nausea, headache, or tiredness, it's important to let your doctor or pharmacist know. To reduce the risk of dizziness, be sure to get up slowly when standing from a sitting or lying position. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. While many people do not experience serious side effects, it's important to contact your doctor if you experience severe dizziness, fainting, or new or worsening symptoms of heart failure. In rare cases, this medication may cause serious liver disease. Seek medical help if you experience symptoms such as persistent nausea or vomiting, loss of appetite, stomach pain, yellowing of the eyes or skin, or dark urine. Although rare, a serious allergic reaction to this medication is possible. Seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. Remember to always consult with your healthcare provider before starting or stopping any medications. Before taking Calan Sr., make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. It's important to discuss your medical history with your doctor or pharmacist, especially if you have certain heart rhythm problems, heart failure, muscle/nerve disorders, liver disease, or kidney disease. Calan Sr. may cause dizziness, and using alcohol or marijuana can intensify this effect. It's important to avoid activities that require alertness until you can do them safely. Limiting alcoholic beverages is also recommended, and it's important to talk to your doctor if you are using marijuana. Before undergoing any surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of Calan Sr., especially constipation, or swelling in the ankles or feet. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. This medication can pass into breast milk, but is unlikely to harm a nursing infant. It's important to consult your doctor before breastfeeding while taking Calan Sr. When taking Calan Sr., it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. This includes interactions with other prescription, non-prescription, and herbal products. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist to ensure safe usage of Calan Sr. Some products that may interact with Calan Sr. include aliskiren, clonidine, disopyramide, dofetilide, fingolimod, and lithium. Additionally, other medications can affect the removal of verapamil from the body, which may impact how Calan Sr. works. Examples of these medications include erythromycin, rifamycins, such as rifampin, ritonavir, and St. John's wort. It's also important to note that Calan Sr. can slow down the removal of other medications from the body, potentially affecting how they work. Examples of affected drugs include isoniprevir, colchicine, elacestrant, fezolinetant, flibanserin, ivabradine, lamotapide, midazolam, and triazolam. Furthermore, some products may contain ingredients that could raise heart rate or blood pressure. It's essential to inform your pharmacist about all the products you are using, especially cough and cold products, diet aids, or NSAIDs such as ibuprofen/naproxen, and ask how to use them safely while taking Calan Sr. As always, consult with your doctor or pharmacist before starting, stopping, or changing the dosage of any medications. If you or someone you know has taken too much Calan Sr. and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include a very slow heartbeat, severe dizziness, and fainting. If you notice any of these symptoms, it's crucial to seek medical attention right away. Remember, it's important not to share Calan Sr. with others. To help Calan Sr. work better, consider making some lifestyle changes such as exercising, quitting smoking, and following a low cholesterol/low-fat diet. Your doctor can provide more details on these changes. While taking Calan Sr., it's important to have regular lab and medical tests, such as liver function tests. Be sure to keep all your medical and lab appointments and consult your doctor for more information. It's also crucial to monitor your blood pressure and heart rate regularly while taking Calan Sr. Your doctor can teach you how to check your blood pressure and pulse at home, and it's important to share the results with your doctor. Keep in mind that there are different brands and types of Calan Sr. available, and some may have different effects. Always consult your doctor or pharmacist before changing brands or types of this medication. If you forget to take a dose of Calan Sr., take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the usual time. Do not take a double dose to make up for the missed one. Make sure to store Calan Sr. at room temperature, away from light and moisture. It's important to keep it away from children and pets. When it comes to disposing of this medication, don't flush it down the toilet or pour it into a drain unless specifically instructed. Make sure to properly discard this product when it's expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.